I would like to show the immune effects by modulated electrohypothermia, challenges, possible solution, verification, and validation. So the challenge, of course, very, very trivial, so I would like really very quickly, what is the task? Destroy the primary tumor, destroy the tumor effectively. The endpoint is response rate, mainly local control. Then there are some malignant processes, which are dissemination and metastasis. Of course, this has to be blocked for that one, that mainly the survival time and quality of life is suppressed by these processes, so we have to measure these two for that one. So it means if we have a local tumor, of course we have metastasis, or the task is that one that modulated electrohypothermia acts like a curative effect, far away, but treat locally. Possible solution. The possible solution which we are doing, that's different than the usual immune action. The usual immune action, very simple, oversimplified of course. Cancer, biopsy or surgery specimen, labor processes, re-injection and cancer immune action. We are doing absolutely in situ real-time points, modulated electrohypothermia, immune support, which is mainly GM-CSF, and modulation template, which we are putting in for the effect. So it means that we are producing immunogenic cell death, ICD, maturation of DC, forming APC, and producing T cells, CD4, CD8, and gamma delta T cells. And of course, this makes the immune products. This is which I would like to show for you that what is a verification and validation. Verification is experimental. We have an experimental laboratory device for that one to show it. So this is the tumor. Then apoptosis is done, and we are producing calreticulin, ATP, HMGB1, and HSP70, eat-me signal, find-me signal, gender signal, and info signal. And these are shown in different experiments which are published a long time ago. It means that 3 years ago. We have patents on this whole process, in situ real-time immunology. So this was done, then the CD3 can be measured, it's also published, and then the APC done, and the CD4, CD8 can be measured, T cells, CD4, CD8 can be measured, and then this makes the process complete. The main problem, or the main immunogenic facility or gene presentation is the HSP70. We can see that all the different experiments, 37 centigrade, 42 centigrade, water bath, modulated electrohypothermia, and radiofrequency 8, which is another capacitive treatment, produces the same HSP70 inside of the cell after 6 hours, 24 hours, and 84 hours. So it's the same. But when we see a membrane localization of HSP70 after 14 hours, it's only can be shown so directly in modulated electrohypothermia. And here are after 6, 24, and 84 hours, the outside liberated HSP70. You can see that modulated electrohypothermia has much larger amount of the liberated HSP70s, which is very interesting that the water bath and the practical radiofrequency, other capacitive treatment has about the same amount of free HSPs. This is an experiment for in vivo. You can see that the right tumor was treated, the left was not treated, but they have the same tumor destruction, and you can measure the DNA fragmentation, calreticulin, and HMGB1, also the same in both sites. So it means the treated site and the non-treated site has the same destruction factors, and you can measure also the dendritic cell, T cells, and so on. I'm very happy to tell you that Mr. Thomas Wanchik is here, who can tell you much more about it, because this was his publication not so long time ago. Validation. Of course, the validation is the most important validation. That is the clinical thing. So, for example, this one is published data on the triple negative breast cancer. You see the one is the breast cancer which was treated. A lot of metastasis is all over the body, but after the treatment of the primary tumor, you have effect in the whole body systemically, and this means a special facility for modulated electrohyperthermia, which I would like really to emphasize that I do not like too much the case reports because that is a cherry picking. So I would like to show for you some other facilities. So for example, this one is from Canada, which was published, was shown in last year. You see that the survival probability is much better than the expected one. It's a retrospective data collection. This is another investigation. This is another one, and this is another one, and this is another one. So you see that absolutely different times, absolutely different countries, absolutely different researchers responsible for these retrospective trials. They have about the same median range, which is very different from the expected historical control. Why I am telling this one? Because unfortunately they have collected only such patients in these trials which are not enough strong for that one that continue the chemotherapy or radiotherapy because the liver failure, kidney failure, or different other problems, and so these patients are really very advanced and had modulated electrohyperthermia like a special advantage. This is the pancreas treatment, the same collection of data which I would like to show. It has an own historical control also, not only the SEER data, which is very well corresponding with the SEER data, and these are the different investigators which they did. It's from Canada, from Hungary, from Hungary again, and from Germany. It again shows that one, and one from Germany as well. Again, that one, that the median survival and the historical control is very different, so it means that we are really on the way that helping for the patients for the longer survival. Of course, the longer survival is together with a better quality of life. Everybody knows that modulated electrohyperthermia uses a heterogenic heating. It means that we are exactly selectively heating the cancer cells, and the cancer cells have high temperature or high energy absorption, but the full cancer lesion has lower temperature. It means that it's below 40, it's between 40 and 39, and this is much more safe. This is the first. Second one, that much more helping for the immune cells in situ, real time in that region. This was all, and I hope that this time will be enough for questions. Thank you.
Are there questions from the audience? So then I will start. If I saw it correctly from the animal data, you showed that there was equal effect on the heated and non-heated tumors regarding immune effects.
Yep.
How could you draw this conclusion? Or could it otherwise also say that there was not such an effect on oncothermia at all due to this set of experiment? Do you have a control to show that there's an increase in these parameters you measured?
Sure, we can have control. So, for example, if you have a mouse experiment, which let's say nude mice, which has no immune or suppressed immune system, then of course you have no such effect. So it means that this is one kind of the control. But the other one, the elder publications can show that we are affecting only for the treated one, and the non-treated was used like a control. Presently, it's different.
Okay. Any more questions? Yeah.
Can you elaborate a little bit on the selective heating of cancer cells?
Selective heating of cancer cells to show it that what.
Elaborate on why only cancer cells are.
Okay. Yes, it's a little bit longer story, and many times I had told it, but I tell you very quickly. Biophysically, the cancer cells and normal cells are very different. Cancer cells are metabolizing much more. It means their microenvironment is different, which with radiofrequency current you can distinguish. You can distinguish the environment with the epsilon, so the permittivity, dielectric permittivity, and you can distinguish them by the other points. For example, by the beta-delta dispersion relation, which catches the transmembrane proteins, which we are really targeting. Plus, we are targeting the structure, which is a self-organized or breaking the self-organized structure of the healthy tissue. So we are applying a modulation, which is a fractal modulation, so the self-organized system is forced. Somehow it means we can concentrate on those cells which are out of the self-organizing.
I think that's a very fair and important comment. And I think we always have to really be careful by interpreting retrospective analysis, and especially in uncontrolled trials.
Yes, I am absolutely agree with you. Presently we had no historical control, but where we had, I had shown. So it's really in the pancreas I had shown. This is the first. The second, the main message was not that one that we are different than the Americans, but the main message was that one that I had shown at least 5 different retrospective data collections which have the same results. So it means that somehow this process is very, very stable in these results. Thank you.
Okay, thank you. Then we will go further on.